One of my favorite mentors early in my training career pulled me aside and he said, "Alex, you're going to need to read chapters and chapters about facelifting before you understand the word salad, the language that's wrapped around facelift." Early on, as facelifts evolved from skin-only techniques, a number of great surgeons distinguished themselves in the academic community by the type of facelifting they were doing. And terms like deep plane, composite plane were initially coined, but then evolved over time, as they should, because the procedures needed to evolve. Deep plane procedures at their very heart address structures that are obviously in a deep plane. Well, what does that mean? There's a suspensory or a saran wrap, if you will, of your face underneath your skin that holds everything up. Underneath that layer, the SMAS layer, are suspensory tissues that are tied to bony coverings and have interrelations that can afford some flexibility in lifting procedures that you don't have access to if you're just on the layer above the saran wrap. And of course, everybody's known that for a long time, but yet, of course, enter surgeons who are, forgive me, a bit prideful, but not just want to distinguish themselves among their colleagues and when they're talking to each other at meetings, but amongst clients. And how is their facelift different than the others? What I love to discuss in my practice is how to disassemble all of that, parse the facelift procedure into the parts, and talk about what each of those maneuvers does really well for that patient in particular.